There's a new type of operating room for people who need minimally invasive cardiac or vascular surgery. The hybrid room offers state-of-the-art tools for limited procedures, but allows doctors to shift to full surgery when necessary. Joining us on Heart of the Matter to explain is Daryl Miller, Baptist Memorial Hospital, Memphis, Director of Surgery. Daryl, thanks for joining us for Heart of the Matter.
Well, you're welcome.
Well, let's talk about this hybrid suite. So describe how a regular operating room and a hybrid suite are different.
Well, years ago, maybe 10, 15 years ago, an operating room averaged about 400 or 500 square feet. With all the advances in minimally invasive surgery, the incisions have gotten smaller and the rooms have gotten larger, bringing in all the additional equipment that we need to support that. Right now, an average complex surgery, like a hybrid room, averages about 800 to 1,000 square feet to accommodate all that additional equipment. In the hybrid room, what we have done is brought in some of the advanced imaging equipment that you find maybe out in a cath lab, in the endovascular suites, interventional radiology rooms, so that the physician now has that advanced high-definition imaging equipment right there in the operating room.
What types of procedures would you do in a hybrid room?
We can do all the procedures that we currently perform, open hearts, stent placement. The real functionality of the hybrid room is that we replace all the trips outside of the OR. A trip to, for example, a patient previously may have come in through the ED, taken a trip to the cath lab, gone back up to the room and gone down for a visit to the electrophysiology lab for another cardiac study, and then eventually a determination would be made and they would come to an operating room. We now marry all that equipment up into one room and it becomes kind of a one-stop shop for the diagnostic portion of that trip and the surgical or minimally invasive application.
And all of that means it's a healthier experience for the patient.
Absolutely. In fact, our goal there is to bring more procedures to the operating room that are less painful, minimally invasive. They bring shorter hospital stays. They get the patient back out into the community quicker.
Well, thank you so much for being here. Daryl Miller, thank you for joining us today on Smart Medicine's Heart of the Matter.
Well, thank you. Appreciate it.